Recently, we discussed some shocking statistics of physicians with depression. To summarize, we proved that mental health issues are especially affecting healthcare workers. Mental health issues within this industry is actually one of the major reasons why there's such a shortage in doctors, nurses, and other professionals. Hi everyone, I'm Matt Moneypenny, and today I'm going to explain how mental health issues within the healthcare industry is leading to a shortage of health professionals. Before we get started, make sure that you subscribe to our YouTube channel by clicking the subscribe button below. Also hit that alert bell icon while you're down there so that when we post new helpful content, you get notified. Many healthcare workers experience high rates of burnout, depression, and emotional exhaustion. This profession has some of the highest rates of these issues. These conditions are leading to a decrease in job satisfaction, which causes workers to leave their positions. One of the leading reasons why physicians are no longer satisfied with their jobs is due to electronic health record systems, which are also called EHRs. These systems take up over half of their workday. In fact, 54% of doctors say that EHRs decrease professional satisfaction. They say that they feel more satisfied when they spend more time with patients, yet they spend less than half of their work hours with these patients because of the clunky UIs within these systems. Eventually, physicians are unsatisfied with their jobs for so long that many of them regret their career decisions entirely. Up to 32% of resident physicians regret their career choice, and this is even before they're finished with their schooling. Regret and dissatisfaction at work cause healthcare workers to leave positions and restart their lives. 1 in 5 doctors plan to reduce their work time. Almost 20% of surveyed physicians said that they would likely cut their work hours in the upcoming year. Over 1/4 said they would likely leave their practice within the next 2 years, and some even said that they plan to pursue a different career choice altogether. Reducing work time due to physician burnout places a massive financial burden on healthcare organizations. The true expense of physician burnout is somewhere between $2.6 billion and $6.3 billion every single year. This cost comes from recruitment, replacement, and training of new replacement physicians. Turnover is really starting to become a problem as well. It's such a problem that the U.S. is expected to see a shortage of up to 122,000 physicians by 2032. That's only 13 years from now. We all know that the aging population is growing in the United States. This means that more patients will need healthcare services. But increased workloads will increase exhaustion in healthcare workers, so even more physicians may end up walking away from their profession. If this trickle-down happens, it would cause an even greater shortage than the anticipated estimates. But physicians aren't the only healthcare professionals who plan to leave their jobs. Half of registered nurses consider leaving their field as well. Nurses experience increased emotional exhaustion from factors similar to physicians that push them to leave their careers. These factors include feeling overworked, too many administrative tasks, not enough time with patients, disrespect from administration, and bullying or harassment from coworkers. Not only is the health industry losing professionals to cutting back hours or switching careers, but it's also even losing them to suicide. Between 300 and 400 doctors die by suicide every year. This is over double the rate of the average American. Working in high-stress environments contributes to depressive disorders for doctors. These can then spiral into suicidal thoughts or even attempts. This problem is even more common with female physicians. According to a report from the American Foundation for Suicide Prevention, death by suicide is 250 to 400% more likely for female doctors. There is a huge, noticeable loss after these suicides. Not only does it affect the friends and family of the doctors, but it also affects the patients that they were taking care of. Let's do some quick math here to help illustrate this problem. The average U.S. doctor treats about 2,300 patients each year. And with up to 400 physician suicides every year, that leaves 1 million patients losing their medical expert. Mental health issues are so common among healthcare professionals, yet it often goes unnoticed. A lot of these people are suffering in silence, and we will eventually notice this through the shrinking number of physicians and nurses. But it's important that we recognize it and take action before it's too late. Organizations need to take care of their employees and offer programs to help handle mental health issues. If you want to learn more information about mental health issues and how they affect healthcare workers, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.